Hi, everybody. I just thought I'd take you through the instructions for using the blood glucose kit because, it can be a little bit daunting when you first start doing it. So you just need to take the kit, open it up, put the blood glucose monitor on the table, take out the Lancet device. Now, what you do with the Lancet device is you take the top off. You put the needle straight in until it clicks, and then you take the top bit off the needle so that you can see the exposed needle. So just be careful, obviously. Then put the top back on until it clicks. And then what I usually do is put it onto, so you move the gray section, you can turn it around to make it deeper or not, okay? Sorry, not the gray bit, the black bit at the top. So you can turn it around. I usually have it on maybe number 2 or number 3. So it's not too deep, but it's also, it goes in far enough to get enough blood. And then you can put that down on the table. Now, at this point, you want to go and wash your hands. Make sure not only are they clean, but they're warm. So cold hands, don't have a lot of blood coming to the surface, and therefore, they make it difficult to get good blood glucose readings. So go and wash your hands in warm water, dry them off on a clean towel, and then come back. And the next step is to break open one of these blue glucose strips. Now you want to try not to touch either of the ends, okay? So you want to try and grab it in the middle on the blue section and then pull it out. And then the black stripy end is the end that you put into the machine. So you just let that kind of click into the machine. And then what you should notice is that there is a blood drop now pulsing on the screen. That means that you've got the strip in correctly and it's waiting for blood to be put into this little white section down the bottom, the little white square, okay? So just leave that on the table, and now you can pull this back. I would suggest doing it on kind of the side of a finger. These two tend to be the least painful. So just put it to the side, and you want to click on this grey button. Now, I just let it kind of hang down for a little bit, let the heart pump some blood down to the finger. Just kind of move your fingers around a little bit while they're down, and then you can bring it back up and give it a little bit of a squeeze. I don't know if you can see that blood there. I think you can. And so then you literally just put it right to the end of where this white strip is. And it should actually suck the blood up. And you want it to be completely full. Okay, so you don't want to be able to see any of the white strip anymore. And that's it. Then it should actually show up a reading on the screen, and you can write that down. Okay, and that's really all there is to it. Then you just want to take the strip out, throw that away. Make sure you remember to take the needle out. Be careful, obviously, when you're taking it out, and all of that goes into the bin. And that's how you do a blood glucose measurement. Thanks.